who is a good candidate to receive a neurotoxin or neuromodulator injection? Anyone who has any kind of wrinkles to the areas that we just discussed. If you have questions, if you're a good candidate, you can absolutely come in and do a consult. We always can treat the same day. People who suffer from any kind of wrinkles that leaves a line kind of there, even at rest, is what we call a static line. So if you raise your eyebrows up and then relax and you see the line kind of indented into the forehead, that's what we call a static line. Same thing in the glabella, the crow's feet, or the other areas we discussed. Those are static lines. Those are lines that require up to 3 or 4 treatments to really see a softening of them, because that muscle has had the ability and the time to strengthen, leaving those wrinkles a little bit deeper and a little bit more aggressive. So still can be treated, but just have the expectation that it may take a few treatments to really get those static lines to soften and smooth out. Another discussion I like to have with my clients when doing a consult or before treating is, how frozen do you like to be? So that's a big conversation. So people sometimes like to have movement, like to have their face still be able to animate, to still be able to bring those brows together and scowl, still have that look of excitement and be able to raise their eyebrows. Some people really do like to have the injection kind of open their eye a little bit. For those of us that have hooded eyes, really like to have that kind of like opening of the eye on that outward lateral canthus. So that's another conversation that you can have with your injector. Understanding that it does take a few days, depending on which neurotoxin we inject, to kick in and see the results of, allowing time to let that happen and giving yourself time between events or any kind of special things happening in your life, making sure that you have that window of time. So in case there is a bruise or any swelling, corrections that need to be made with the injection, you have that time that you can get it corrected with us. Some complications that can happen are, not ideal, but can happen with injection is bleeding from the site. Typically it's very small amounts of blood. When the needle's injected, we use a very small 31 gauge insulin needle for our injections, meaning it's very, very tiny, and hopefully just a drop of blood comes out. Every once in a while you may hit a very small vein or vasculature, which will cause some bleeding, but typically it's controlled within the time of the appointment. Bruising can also occur. That also is unintended, but if you happen to hit a small vasculature within the tissue, sometimes a bruise can be formed. Typically resolves within 2 to 4 days. But again, something we don't really know until the time of injection. That's why we want you to kind of plan around any important events or special occasions that are happening in your life. Otherwise, other areas of the forehead is the kind of one where we can see what we call a spock, meaning one eyebrow is kind of raised higher than the other. It is correctable. We can just put a little neurotoxin and lower and relax that muscle further and kind of even out the eyebrows. You can also develop ptosis, meaning if you inject too close to your orbicularis oculi muscle, that you can kind of relax that muscle and cause ptosis, meaning your brow is dropped. Again, not intended, doesn't happen on purpose, but sometimes it can happen depending on a multitude of things. So if anything ever does happen, complication after an injection, absolutely reach out to us and we will do whatever we can do to make the situation right and better for you.